Greetings. My name is Genevieve Fadiami, and I'm the Associate Director of Corporate Sustainability and Social Impact at Novo Nordisk. We are pleased to support the Black Health Matters Fall Summit and this special presentation on managing diabetes. One of today's most serious health challenges, more than 30 million Americans in the US are living with diabetes. Diabetes is also one of the most serious health problems that the African American community faces today. Compared to the general population, African Americans are disproportionately affected by diabetes. Novo Nordisk has been changing diabetes for over 95 years, and today we are the world's leading company in diabetes care. It is our heritage with diabetes that has given us the experience and capabilities to help defeat other serious chronic conditions such as hemophilia, growth disorders, and obesity. As you watch this presentation, please note that while many can access and afford their medication through insurance coverage, we know that as the healthcare system has changed, a growing number of Americans with diabetes struggle to pay for their healthcare. And this can include paying for medicines produced by us. As a company focused on improving the lives of people with diabetes, this is not acceptable. In January 2020, Novo Nordisk expanded its insulin affordability offerings to help people with diabetes who need alternative solutions. These options, along with the information on the existing patient assistance program and the copay cards, are now available online at novocare.com. Now, it is my honor to introduce you to this afternoon's presenters. First, I'll introduce Dr. Angela F. Ford, PhD, MSW. She is the Chief Program Officer at the Black Women's Health Imperative. After 22 years of service, Dr. Ford accepted an early retirement from the University of Pittsburgh, where she also received both her master's and PhD in social work, and served as the Executive Director for the Center for Health Equity in the Graduate School of Public Health. She relocated to the DC area and joined the Black Women's Health Imperative in 2013. As a Chief Program Officer, she provides leadership for their programs, training and technical assistance portfolio, including their lifestyle change program, Change Your Lifestyle, Change Your Life, which has been implemented in 13 cities and states with 18 program partners. Black Women's Health Imperatives Program Provider Network has enrolled over 3,400 participants since 2013, placing special emphasis on outreach to Black women and Latinas. Next, I will introduce Dr. Niva Lubin-Johnson, MD, an advocate of quality health care for all, especially the underserved and underrepresented. She was installed as the 119th President of the National Medical Association. Dr. Lubin-Johnson received her Bachelor of Science degree in pharmacy from Creighton University and her medical degree from Southern Illinois University School of Medicine, where she was distinguished as a member of the last class to finish within a 3-year time frame. She completed her internal medicine residency at St. Joseph's Hospital, Chicago, and has been in private practice for 28 years in the South Side neighborhood where she grew up and a current resident. She is currently a senior attending physician at Mercy Hospital Medical Center, associate attendant at Advocate Trinity Hospital, and a clinical instructor at the University of Illinois. And now I will hand it over to our presenters, Dr. Angela Ford and Dr. Niva Lubin-Johnson.
Thank you so much, Genevieve, for that introduction. Also, thank you for the organizers for inviting us to share what we're doing in relation to diabetes prevention. And it's also an honor to share the panel, share this presentation time with Dr. Niva Lubin. I will start by giving you some information about the Black Women's Health Imperative. A little background. We are a national nonprofit founded on the campus of Spelman College in 1983. And we are dedicated to improving the health and wellness of the nation's 21 million Black women and girls physically, emotionally, and financially. We focus our core issues and our work and our mission on sexual health, reproductive justice, wellness, and avoidable chronic disease mortality, and access to care. I'll be talking to you a little bit today about our lifestyle change program, as Genevieve mentioned. Change Your Lifestyle, Change Your Life is our brand. I want to give you a little background about how we got into this work. About 15, 20 years ago, NIH funded several clinical centers around the United States to determine if losing a modest amount of weight and improving diet and physical activity would give individuals who were at risk for getting type 2 diabetes a better chance of doing that versus taking the diabetes drug metformin. They enrolled about 3,000 participants who actually were diagnosed with what was called prediabetes, which means your blood glucose level is higher than normal, but not high enough to be diagnosed with type 2 diabetes. And they put individuals into 3 groups. One was a placebo group where they didn't get any medication at all. The other group got the drug metformin, and then the other group got lifestyle interventions. So they focused on physical activity, healthy eating, stress reduction. And what the research showed was that weight loss was the most important factor in lowering the risk for type 2 diabetes. And that effect was the same across the board, regardless of sex, socioeconomic status, race, and ethnicity. Although we learned that Black women and Latinas did not do as well as the other groups. But again, across the board, the lifestyle change group did better than the metformin group. And so you can see from this table here that it reduced the chances of developing type 2 diabetes by 58% in the lifestyle group. And for individuals 60 and over, it was 71%. So Congress commissioned the CDC to create a curriculum and to make the program available to individuals who could benefit from it. So the Imperative was one of the 6 organizations that was awarded by the CDC to work with them to take their evidence-based National Diabetes Prevention Program to scale. As Genevieve said earlier, we've enrolled to date over 3,500 participants in 13 states with 18 program partners. So the program is a year-long program, 12 full months. There are 2 phases. The first phase, the first 6 months, individuals attend 16 weekly sessions, and then they go into bi-monthly sessions for the remainder of the year, the remainder of the 12 months. The goals of the program are to lose at least 5% of their weight and to maintain 150 minutes of physical activity weekly, and that can be spread out over the week. The program is group-based, so you meet with other individuals who are facing some of the same challenges and committing to make healthy changes to prevent type 2 diabetes, and you're assigned a trained lifestyle coach. During the first 16 weeks, the focus is on how to adopt healthy lifestyle, which includes making healthier food choices, again, increasing physical activity, managing stress and emotional wellness. And then also what is really key to a lot of individuals is how to deal with those elements that are in the environment and may create challenges or barriers to losing weight. And that would include food triggers, social triggers, you know, those smells when we smell good food and we want to eat it, and then how to change negative thoughts. And we know that oftentimes the way we think about things contributes to our behavior or how we respond to things. During the second phase of the program, individuals oftentimes have met their goals and they can set new goals. If they haven't met their goals at the 6-month mark, they can continue to work on those goals. And then there are always folks who perhaps were successful, but then, you know, like we say in the church, they backslid, you know, they had a relapse. And this second phase of the program gives them an opportunity to get back on track. So what we've launched in October is accessibility to the program through an app. So we have, it's called the BWHI app. You can get it in the Google Store Store, the Apple Store. You can download it. You can join a community. I'll give you the website at the end of my presentation if you want to actually join the program or get more information on the program. But we typically for the last 8 years have delivered the program in person. We started working on an online version of the program last summer, and it's actually very timely now since everything pretty much is online. So we've just launched it in October. We took the curriculum, the CDC's curriculum, we culturally tailored it for Black women, and some of the other programs that we're going to be building into the app is a focus on younger Black women and also Black men. So in the app, you have an opportunity to stay engaged between the sessions, between the live coach sessions. There are rewind videos that reinforce what you've learned in the previous session. There are reminders that go out. There are teasers. There are library of resources, videos, opportunities to try different kinds of physical activity if you haven't before, or to continue to do those if you're doing them. Participants receive affirmations and messages. And then we have several live recorded events. For example, we're going to have a session called Dish Divas, where a personal chef, nutritionist, will be showing individuals how to make over some of their favorite dishes and to cook on a budget, and how to shop for food and to shop and find things in the grocery store that are the healthiest for you to purchase, and how to do those things, again, like I said, on a budget, keeping your budget in mind. We also have what we call Black and Well TV, powered by CWOW Squared. We do Black and Well every week. Currently, if you go to our YouTube channel, you'll see lots of programs that we've already produced. And then we have something called the Coaches Corner, where coaches will get together with a group of participants and bring several classes together. And then there are communities that you can join. There's a community within the program that you can join and share information and be of support and get support by individuals in your class. But then there are also other communities that are open to the public that you can join and also post information in if you have it. When we culturally tailored the program, we added several modules. Again, this is a 12-month program with a specific module for each session. And so there are about 26 modules. We added one that's called Chronic Stress, Intersectionality, and Lived Experience, because we know that chronic stress is a major factor for Black women when it comes to managing their weight. A module that's called Practice Self-Care for Life, because we also know that practicing self-care is very important when it comes to reducing stress and really just taking care of ourselves. We added a module called Aging Like a Fine Wine, Achieving Weight Goals During Midlife. We have 2 modules on that. And because we've also found that a lot of the women in our program, when they get to that midlife point and they start putting on weight because of hormones, they're not quite sure how to manage that. So we built in a couple of modules to address that. And the whole issue of money comes up often. And so we want to help people be able to think through how they can shop and budget and plan for healthy eating, because a lot of people really believe that eating healthy is just more expensive. In many instances it is, and we know that there are places where individuals don't have access to healthy food, and so it does become a little more costly. So if you're interested in learning more about our program, go to our website at bwhi.org/CYL2. You can take the risk test there. You can learn if you are eligible for the program. And if you'd like more information, please feel free to email me at afford@bwhi.org. Thank you so much.
Do you all see my screen? Good afternoon.
Yes.
You do? Okay, great. So thank you once again. It's a pleasure for me to be here with you. Here in the Midwest, I really appreciate it that if you are here today, because it's a lovely day outdoors, it's 75 degrees, and I hope it's as lovely wherever you all are tuning in from. I am Niva Lubin-Johnson, and I just want to share a couple extra things about my bio. I am no longer in private practice. I am Chief Health Officer for Simcoe Solutions. It is a preventive managed care organization. We want to help people take better care of themselves by emphasizing preventive care. And so this afternoon, I'm going to focus on some of that with diet and exercise in terms of diabetes and treatment. And I want to thank Angela for her presentation. You know, it really is a good lead in to what I'm going to talk about today. And I should say this afternoon, not this morning. But thank you, Dr. Ford, for your presentation and all the work that BHM has been doing. So diabetes affects 1 in 10 African Americans. Treatment should begin with diet changes and exercise and then medications. I'll briefly talk about a few of them, metformin. And there's actually a question in the Q&A about metformin. But metformin acts by a decrease in production of glucose, or sugar, as most commonly call it, in the liver. It decreases absorption of glucose in the intestines, and it increases the body's sensitivity by increasing how glucose is utilized. And sensitivity is important because what happens in type 2 diabetics, that sensitivity, which is the most common form of diabetes. Insulin is a hormone in the body. In type 2, it's not recognized by the body or is resistant. In type 1, not enough is produced. And there's different types of insulin: basal, which lasts for 24 hours or longer, and then short-acting, which is usually given around mealtime. And then there are two newer classes. GLP-1 agonists, it actually targets a hormone so that glucose, it controls the glucose increases when we eat, and so it helps limit weight gain, and actually most people get some weight loss with using GLP agonists, and so it enhances the activity of GLP-1. And then SGLT2 inhibitors, and I typed out the name so you all could see why it's abbreviated, but what happens is these medications actually inhibit the reabsorption of glucose by the kidney, so it prevents blood sugar from going up because of that, and then it helps that glucose get passed in the urine. And so diet, most often is recommended a ADA diet. Let's see, I need to go back. ADA diet from the American Diabetes Association, and you would receive that education from a diabetes educator or a nutritionist. With the internet, of course, and apps, you can also educate yourself. But you really should have some guidance in terms of, how to, do this diet successfully. What's most important about this diet is counting carbohydrates. And, we all hear about carbs all day. So what is a carbohydrate? It's a sugar, a starch, a fiber that's found in fruits or vegetables or grains, dairy, and even meat and seafood too, but much less. If you read labels, and you should read labels on your foods and your drinks, 15 grams of carbohydrates is a carb serving. And that's important because when we talk about how many carbs to get in a serving in a meal, what's recommended from ADA is 2 to 3 carb servings for women, actually, and 3 to 4 for men, and then 1 or 2 snacks, and 1 carb serving for a couple of snacks every day. So I actually, when I was in practice, I recommended lower carbs per meal for patients so they would need less medication. So I would suggest that women stick with about 2 carb servings per meal and men 3 carb servings per meal. Then therefore they would need less medication and get their A1Cs to go. And what's important with, you heard Dr. Ford earlier talk about A1Cs being normal and slightly elevated, not diabetic. Goal A1C, if you have diabetes, is typically 7, unless you're a senior. and I'll use the age of 70 for this purpose, in that typically we allow a little higher A1C, because with a lower A1C, you're more apt to get episodes of low blood sugar, which could lead to some problems like passing out, falling, hitting your head, breaking a hip, even cardiovascular events. The only things to really avoid with a diabetic diet, the ADA diet, is, no regular pop or soda, as pop we call it here in the Midwest. And also, I wouldn't recommend fruit juices, because the whole fruit and fiber is much better. And fruits are a great snack, and green vegetables can be eaten in almost unlimited amounts. Portion control is key with diabetes and really all of our diets. And, most starches, a half a cup is a serving. Most meat, seafood, 4 ounces is a serving. You should have a 9-inch plate, not 11 or 13, as we become accustomed to. And that plate should have a fourth of carb, a fourth of meat or seafood, and half of vegetables, and 2 snacks every day, ideally fruit. But I'd be remiss if I didn't talk about how plant-based diet, or commonly referred to as a vegan diet, could help in controlling diabetes, even lower the incidence of it, and better control of diabetes also. And so we've got many famous entertainers, celebrities, sports figures, even physicians, who follow a diabetic diet. Terry Mason's here in Chicago. He started, I'm not a diabetic diet, vegan diet. He started following vegan diet after he had a cardiac incident. Kim Williams is the first African-American president of the American College of Cardiology. He's been vegan for years. And Baxter Montgomery is a cardiologist out of Houston, Texas. I believe he not only practices a vegan diet, has a big practice where he's teaching people how to eat that, but also I think he concentrates on raw food. So, very important for various reasons. So what's animal fat got to do with it? Well, when you eliminate animal fat and then animal products, you actually help cells to handle insulin better. And so decreasing those fats from animals actually helps cells to repair, and insulin functions better. Research shows that with type 1 diabetes, almost all diabetics could go into remission, and type 1 diabetes, 20% could go into remission. Exercise, it's important because, CDC has stated inactivity is more harmful to our bodies than smoking. And we know how harmful smoking is. But inactivity leads to heart disease and stroke, even dementia, in addition to diabetes. And so 40% of diabetics are inactive, and it promotes type 2 diabetes and increases the insulin requirements for type 1 diabetes. And exercise can decrease the glucose by 50 points. It could be the difference between someone being on medications and someone not. And so it improves the muscle's ability to use insulin, and also decreases, like I said, that insulin requirement. So exercise, again, I talked about insulin sensitivity and tolerance, but also for some other illnesses, of course, in terms of controlling cholesterol. And most diabetics have high cholesterol. It decreases the total cholesterol and triglyceride and increases the good cholesterol. And so we want to do anything that's going to increase our good cholesterol. So what exercise? Aerobic activity, walking, jogging, swimming, jumping on a mini trampoline, jumping rope, aerobics, yoga, Pilates. And then you want to do some muscle strengthening and building also, because muscle is responsible for 80% of blood sugar after a meal. And so you have more muscle on board, you got somewhere for the sugar to go. If you have more fat on board, the sugar has nowhere to go, and then your blood sugar goes up. And so benefits of exercise also remain for up to 36 hours. I just want to make mention of one vitamin, vitamin D, because it behaves more like a hormone, and studies show the lower the vitamin D level, the higher the glucose. So you really want to make sure your vitamin D level is normal, and especially African Americans. When I was in practice, I probably said 80%, 90% of my patients were deficient in vitamin D. I was deficient in vitamin D when I first got it tested. And that was after I spent 6 months with an increased dosage of vitamin D without testing. It was still deficient, and I need to take at least 2,000 units every day. And this is because African-American, you can see I'm dark-skinned. I live in the Midwest, Chicago. So, 6 months, we don't have much sunlight. And you need that sunlight to make vitamin D. So that's important also. So you should get it checked annually. Most likely you'll need some kind of supplement. Low vitamin D level can also, there's been a association of increased incidence of cancers and multiple sclerosis. And although this is less of an issue for African Americans, it also is good for bone health in terms of preventing osteoporosis. So I want to thank you for your time and attention, and I think I've left a few minutes to answer a couple of questions. And I'll go ahead and answer the one for metformin. Yes, I've heard that also. You should talk with your physician about metformin and the risk of cancer. Thank you. So I don't hear Deirdre or anyone else, but I'll go ahead and answer a couple of these questions in these last 4 minutes. Is it ever possible to stop taking Lantus? If you're on Lantus because you have type 2 diabetes and you're overweight or obese, with a doctor's guidance, it is possible for you to decrease, and then hopefully that doctor would decide for you to stop taking it. You should not stop taking it on your own. Your blood sugar will go up, and that could cause you some problems. If you have sickle cell disease and diabetes, what's the best eating plan? You should see a nutritionist about a diabetic diet, but I would also suggest you do some research on a plant-based diet. I actually heard someone speak last year who has sickle cell anemia, and he did not have any more sickle cell crises after he went to a plant-based diet. So I would seek out, someone who is knowledgeable in plant-based diet and get them to help you with that.
And Dr. Lubin, I'll answer one of the questions regarding the program. The question is, if you are pre-diabetic, can you join the program? And I want to say definitely. In fact, that's the primary audience for the program. The eligibility is 18 and older, having a BMI of 25 or more, and you either have to have a diagnosis of prediabetes, a history of gestational diabetes, or score a 5 or more on the CDC's risk test. So if you go on our website, you'll see all of that information, and you can also take the risk test. And the name of the app in the App Store is BWHI app.
So there's a question about living in Florida and the sun makes it impossible to achieve natural sunlight. So I actually go to Florida a few times a year, and how I get my sun during the warm months is I go out early in the morning to walk. So, I get up and I'll be outside at like 7:30 before it really gets hot and humid. And it doesn't take a lot of time in the sun to get the sunlight that you need. You only need about 20 minutes. So if you do that earlier in the day, it's unlikely that you'll get overheated from that sunlight. The A1C for seniors, normal, goal is 7. Seniors is somewhere between 7.5 and 8 that you want to have for goal. And like I said, it's because you're at greater risk of cardiovascular disease, falls, breaking a hip, hitting your head, etc. Question about diabetes can be cured with diet alone and no insulin. That is true. And a lot of people aren't on insulin with diabetes. Most people are controlled with oral medications and the GLP-1 agonist now, which is an injectable. But the key is losing weight and exercising and keeping the weight off and exercising. And you shouldn't stop your meds without the guidance of a physician. So I think we're at 2:15 now. Can one of our facilitators come in for us. Thank you all for, participating this afternoon. We're almost at 150, so this is really great. And I want to thank Rosalind Daniels and the Summit, for inviting me to participate.
And me as well. Thank you very much.
Thank you.
Hello, everyone. I just want to thank you for joining us for that session. And be sure to tune into our next session on mental health. Thank you so much. And you guys have a great day.